Hello, colleagues joining us back online. I have written in my moderator script, it says post-break, energizer and warm-up. So we were thinking about what we could do, and it struck me the fabulous diversity of people we have around this table and online. So we're going to ask you a question on Slido, just to try and capture some of this. So the question we're asking you is, what country or cultural ties do you have? Because we recognize that people have many different connections to different cultures, different languages, different countries. So let's start to build up this picture. What country or cultural ties do you have connections with? And we'll start to get a sense of the glorious diversity of this community that is both here with us and online. So that's what we want to know. What country or cultural ties do you have? What's in your family? What's in your language community or your religious group? Where are your connections? Just so we get a sense of the beautiful diversity of the human race and of our community. So already it's starting to come up. You can see we've got several continents here. We've got Asia, we've got South America, we've got Europe. Wow, great, Indo-Persian, fantastic. Egypt, Nicaragua. Privileged land, that's an interesting one. And we have community connections like Roma people, so community, so that's great. We wanted to try and understand the fact that people have multiple identities, multiple communities, language groups, affiliations that they have, and that's part of what makes us all so interesting and so diverse. So thank you all for starting to share that. And we'll just let that picture build up a little bit. That's our post-break energizer and warm-up to just celebrate the extraordinary depth of community and cultural experience that we draw upon when we have these conversations about racism and discrimination. Let's just take a moment to celebrate all the connections and ties that we have, the narratives and stories that we bring in, our identities and how we see each other. So again, we're building this up to see how this is developing. But again, I can see we are all around the world as part of our broader community. So thank you very much. So let's reflect. This morning we explored what the evidence and the research is telling us about the link between racism, discrimination and health. We explored the physiological, the biological and mental health impact. We heard examples from different countries we heard from France, we heard from Belgium, we heard from Spain, different approaches, different tools. And then just before the break, we heard what the tools exist at European level. So we heard from Mila, the European Anti-Racism Coordinator, and from Stefan Schreck, representing the European Commission DG Santé, looking to see what tools they have. In the afternoon section, we are moving away from that link to what is racism, what is discrimination, what is health, and how do those all fit together. And we're now going to focus more on the right to health. We heard at the beginning of the day in the treaty, you've got various different ways that the EU treaty sets out barriers and tackles anti-discrimination. We heard about equality strategies, but what we want to understand is a practical understanding of the right to health as it exists in international treaties, how it's interpreted. And I'm delighted to say that we've got someone who's a real expert who will take us through this quite complex environment. So Mila Paspalanova. I wanted to get the accent in the right place. Who's the anti-racial discrimination advisor at the OHCHR. She's going to explain the right to health, and she's got a lot of information to share, and the PowerPoint will be made available to you afterwards. So don't panic, because we know there's a lot of great content in there. She's also going to leave time for questions from you, the audience. So note down anything you'd like to ask her, and I will, if Mila gets too passionate and keeps flowing, I will signal to her to make sure there's time for your questions, because we like this to be, Mila is an incredible resource, and we want you to be able to have access to it. So Mila, I'm going to pass you the floor.
Well, thank you so much. I think you raised the expectations a lot because in fact I was left with half an hour to touch upon 3 topics. Do you hear me without the microphone? Because it's quite a lot of things I have to.
Yes, but
Yeah.
online.
Oh, it's for the people online. So the idea during the next half an hour is to touch upon 3 huge topics about which in our agency and in other UN agencies, there are whole departments working on those. One of them is the international normative framework related to the right to health and the right to non-discrimination and anti-racism. I'm not a lawyer, but lawyers know how much they study international law and how much time they dedicate to those topics. So for this, we have around 7 minutes. And then the topic of international recommendations, which is another body of over, by the different mechanisms, thousands and thousands of recommendations, another 7 minutes we have. And then the topic of human rights indicators, same amount of time. So I have prepared a short presentation, which I will not follow exactly because we don't have the time, but what I would like to leave from there are the online resources to which you can go and make really deep exploration about everything that comes from the international arena regarding normative standards that can influence and ideally impact the definition of public policy at EU level and at national level. Then international recommendations, all the body of international recommendations that also ideally should be used by policymakers at the level of planning, state level, federal level, municipal level, even city level, okay? And then the whole body of human rights indicators that also ideally should and can be used for measuring the impact of implementation of any policy that has human rights component. So what do we have from the international arena and why is it important to take it into consideration? I think we touched upon a lot of examples in the morning, some of them very concerning, some of them anecdotal, some of them not, that demonstrate that definitely there is some kind of bridge between what's going on in the field, how much that human suffering is. I cannot stop being surprised by the fact of how we misunderstand the importance, for example, of stress and trauma. No, we have normalized it so much, we repeat it even like something so commonsensical, and we lose empathy, we lose perception of what exactly means to live with stress or to live with the impacts of trauma, not to go in the topic of complex trauma, for example. Okay, so we know where the problems are, and then for some reason, we do not manage to translate them at the level of public policy. And even if we manage to translate them at the level of public policy and programming, then somehow it costs us a lot of trouble to make one step forward and to measure the impact of those policies. And again, in the morning we spoke, if we do not measure what's the impact of our policy, later on when we go to our ministries of treasury, for example, to ask for funding for any policy or program at the local level, the first question the Treasury will ask is, what is the evidence about this? Why should I fund? Or legislative assembly, whatever it's called in different countries. So the 9 core human rights treaties that we have, there are much more, but I will cover only 9 that come from the international arena, are core treaties that are, and here is the key, normatively binding. Okay, this is international law. Every time when a country signs international treaty, it's like the national legislation or the federal legislation, country has an obligation to comply with redundancy with their treaty obligations. They have also established, by the virtue of having signed these treaties, and the treaties have established committee of experts that monitor the level of implementation of international obligations. Bear with me, it sounds a little bit boring in the beginning, how much they are implementing their treaty obligations. And the third most important and very obvious thing is that they apply without any distinction of race, ethnicity, religion, sex, national origin to all people, with some very minor parentheses. For example, people who are not nationals or people who have been in prison, can they vote or can they not vote? No? In all other cases, international treaties are universal. So here are the 9 ones. And now, Thomas, if you can go in a while to the next slide, just to show an interactive map. Okay, let's enter in this link. The core treaties that we have include one of the oldest ones. Of course, we have International Bill of Human Rights, and then we have the International Convention on the Elimination of all forms of racial discrimination. And then we have the International Covenant on Civil and Political Rights and the International Covenant on Economic, Social, and Cultural Rights, and so on and so forth. I have put the 9 on them on the slide, just to transmit the message that each and every one of them speaks about non-discrimination and prohibition of discrimination based on the category of race, about each state that has ratified them. And here again, we will say it's very, very obvious. Well, it's obvious, but still we do not comply with our international obligation. Okay? Then most of the international treaties, because you can see some of them have to do, for example, with prohibition of torture and enforced disappearance. Those that are relevant to the right of health include the OHCHR, the Convention on Elimination of Racial Discrimination, the Economic and the International Covenant on Economic, Social, and Cultural Rights have specific articles that speak about the steps that states should make in order to comply with the right to health. And remember, health we understand is the highest attainable standard on physical and mental health. Okay, the Convention on the Rights of the Children, the CEDAW, all these international treaties speak about prohibition of discrimination based on all criteria that we saw, and on the right to health. So there is a very solid body of international instruments, and these are only 9 out of many, many others that you can find, that set the grounds for translating what are the international obligations of states into public policy. Okay. However, this is not happening. And as Michaela Moa was saying before, why is it so important, the small baby steps that we are making at policy level by including a reference to international treaties in our EU policies or national level policies, is because this is the way that we will oblige ourselves to make the steps necessary for complying with what we have agreed to do based on our international obligations. Now, when we go to the interactive map, Thomas, if you can help me, and this is something with which you can play, there where it says ratification of 18 International Human Rights Treaty, click on this. Let's select the Racial Discrimination International Convention, the first one, which is the oldest one. Let's click on it. We have the European countries. And here you can see every single European country, well, other parts of the world as well, every single European country has signed this. So we can make the story really, really simple. And I think we have heard this also in the morning. We overcomplicate very often our discourse. We have one international treaty that has set all the grounds for elimination, eradication, prevention, protection of all people against racial discrimination. Every single European states, well, with a couple of exceptions, all the world has signed this international treaty, which says what we have to do in order to eliminate racial discrimination. So the question is not the lack of normative framework, because this is something that also we very often hear. There is no normative framework that is sufficient. We need to harmonize our legislation in Europe. Most of the legislation has been successfully harmonized. So the same search you can make about the International Covenant on Economic, Social, and Cultural Rights, Covenant on Economic, on Civil and Political Rights, and you will see that countries have signed those treaties. Okay, so let's move forward. I will kick you out of here if we go back to our presentation. And then if we go to the Universal Declaration, for example, of Human Rights, going even a little bit backwards in time, 1948, since then, states have made an obligation to make prohibition of any discrimination based on racial or ethnic characteristics on Article 2, and Article 25 speaks explicitly about the right to health, with the definition what we should understand under the highest attainable standard on the right to health. 1948, we have it over there. In 1948, we also had a definition to what are mothers and children and babies entitled under the international obligation. So we have all the grounds for moving forwards, and we really have to think how are we translating this international framework into public policy. Do I still have a minute or so to continue here? Okay. Now, we mentioned in the morning a couple of very important essential elements when we're speaking about the right to health. One of them has to do with adaptability of health services. And very often policymakers or those who implement policy, or let's say public health sector, I will give you examples from Latin America. Public health sector in Latin America says, well, we cannot make our health service culturally adaptable to the 80% of indigenous population that we have here, because we don't have any obligation whatsoever to do so. So for this international treaties serve you, because first they set the definition on how to advance with the implementation of this right. And then there is something else, this thing that you can see here, general comments or general recommendations are the way the committees, remember those bodies that observe how much states are advancing with the implementation of the treaties, they make clarifications in specific documents that say, okay, what are you going to understand under the right to health? When the states wonder, no, what should I do in order to advance? So the Committee on Economic, Social, and Cultural Rights has one general comment, it's number 14, it's in your concept paper, that defines what are the essential elements on the right to health. And this includes availability, accessibility. Accessibility includes physical, economical, access to information as well. All people should have adequate access to information regarding their diagnosis, treatments, provisions, and decision-making. We touched also upon this topic. It's like people do not have sufficient information about their diagnosis, for example, and they cannot make adequate decision on how to move forward with their treatment. Includes non-discrimination as well. Adaptability, it comes in general comment number 14. Adaptability means that health systems should be adapted to the specific needs of population groups residing on the territory. Here, we don't speak about residing legally or illegally. Okay, all people who are on the territory of a state that has signed the international treaty should have some sort of access to adaptive health services. There, very often we ask the question, well, what happens when we don't have money to do all this? Which is a very reasonable question. What happens when we do not have the financial resources, for example, to provide interpretation? Okay. There is another provision that comes from international treaties, which is non-regressiveness in the implementation of human rights. So here what we have to assure is every time when we make a new law, legislative harmonization, implementing treaties, that we are moving progressively forwards, that we do not go backwards. So if today I have 100,000 for interpreters on economic, social, cultural rights, they're giving me the sign that I cannot speak more about this topic. Next year, I should assure that I have at least 100,000. Okay, so moving forward to the next question, because they are general, it's a topic about international recommendations. Just again, we will make the announcement here that the draft general recommendation 37 of the Committee on Elimination of Racial Discrimination is under draft now, and we're going to co-organize with the CERT, ideally with EFA as well, in January, a consultation on how the text of this general recommendation should stay. So when it comes from in the international arena, it feeds directly to public policy. It gives a direct input. If policymakers are wondering, how should I do it? Okay, there it comes, more or less the, let's say, instruction under comillas, how do I say it in English? Yes, how to draft it. So you can find it online, and this link is going to be in your presentation. Now we can move with the next question because time is running. And please participate. Please participate in those exercises of defining the implementation of the standard. Great.
So let's now move on from the international normative framework, because you showed us it's a number of treaties and comments. Now what we want to understand is more about the international recommendations from those treaty bodies. What are they and how do they link to the EU and national policy on anti-racism and health that we discussed in the morning? So how can people make a conceptual link between the big global treaties and then what's happening at EU and national level?
Okay. We are rushing very much. Again, I have included link here in your document where you can enter. Here is you will find a huge body of international recommendations from which you can more or less get an idea of what are the biggest problems in different countries. But what are the international recommendations? Okay, the international recommendations are emitted by those committees who examine states. No? It's different numbers of years that states have to present periodic report, okay, to the treaty body, the committee that examines its performance, to demonstrate how they have advanced with their treaty obligations. For example, if I have signed the Convention on Elimination of Racial Discrimination, as country X, I have to present my report to the treaty body, and this report usually is supplemented by, it's not compulsory, but very often it's done by so-called shadow reports presented by civil society organizations. Sometimes even United Nations agencies in different countries can co-participate in the accompanying of civil society organizations in presenting these shadow reports. So once the treaty bodies examine the performance of the country, they come with recommendations. Sometimes they're called also concluding observations, pinpointing what are the good practices, what is being recognized as the country has advanced in this and these areas. And then they recognize where the country can advance a little bit more or what has to be done quite substantively more. You can consult by country. Here I have not included any disaggregation by country because the information is humongous. Just the third committee, the Committee on Elimination of Racial Discrimination, has emitted more than 1,600 recommendations to EU member states. When we include recommendations to EU member states on health, by the third, they sum up to be more than 160. If to those we include the recommendations that come, for example, from the CEDAW, very relevant topic, we're covering so much here, the intersection between racism and gender and the situation of women or Roma, woman, health, education, those number of recommendations increase substantively. Thomas, can we enter in this link just to show how it is and where they can find it? Okay. So you can start making your own searches in the so-called Universal Human Rights Index. Bear with us because it's not 100% updated, but you can find, well, let's say probably 85% is the level of update of international recommendations that we have in the databases. You can go a little bit down. Let's find the Universal Human Rights Index. You enter here. Universal Human Rights Index. I just want to lend you to the page, start your search. And here you can start playing by countries and making combinations between treaty body. For example, let's see what the Committee on Elimination of Racial Discrimination or the Committee on Economic, Social, and Cultural Rights have said, or you can select both of them. See, for example, here you can click to mechanism. And from mechanisms, you select the bodies that you want to see. You can search by country. You can search by concerned people, people of African descent, Roma populations, and so on and so forth. And you will find the direct text that treaty bodies have said to different countries on different topics. And here you can find, for example, recommendations that speak about the fact that the obstetric violence against, somebody was asking the question in the morning, is there research about violence against women, what is being recorded about the Roma population? I don't know from the academic research, but from treaty bodies, you can have very good overview about which are the countries with the biggest problem of obstetric violence against Roma women on their territories, okay? Or intersecting forms of discrimination. What are the major topics covered by the international recommendations when we speak about health and racism together? Okay, more than 50% of the recommendations speak about lack of data and statistics, which means that, and this is data about the 27 EU member states, which means that when the committees have examined the performance of the countries, the biggest percentage of recommendations have to do with the lack of data and information. And when you start playing with the database that we have shared with you, you will see the direct text, the recommendation of the treaty body that says, we recommend to this state or to Ministry of Health or to the justice sector or to the administrative justice sector or prosecution to start creating databases, statistical databases, including categories related to sex, ethnicity, gender, etc., etc., etc. What I'm trying to say here is that from the international recommendations, you can have input for defining public policies in different areas, in health, in education, non-discrimination, and so on and so forth. So very often we tend to try to invent new things through consultation processes that we have to take into consideration always. But when we're searching for new definitions, we should not forget these are obligations of states. This is not something which is goodwill advisory to do. This is international normative obligations. EU member states have signed those treaties. And one of the problems that we have here, and I'm coming back to the very good practice that Michaela Moa was just mentioning before, the moment when we start including reference to those instruments in our policies is when we are going to start taking them more and more into consideration when we are defining our statistical data sets. From the international arena, at least from OHCHR framework, there is no such prohibition of non-recording information based on race. Quite on the contrary, all recommendations speak about you have to disaggregate data by race. And then we go back to the normative framework where we have to see the different states at what level, constitutional level or before, the state has assigned to international treaties. If international treaties go at constitutional level, there is no state level argument that can say, no, I'm not going to record information. And the rest, I didn't cover them because I'm sure that you read on the slides, but they have to do with access to harassment, desegregation, discrimination, segregation, medicine supply, health coverage, interpretation, mental health, all the topics, forced sterilization, and so on and so forth. And from here, with all this body of input that we have from treaties and from recommendations, we come to the topic of
what is the international input on measurement and statistics? Big issue that we picked up earlier. Can you tell us briefly about the OHCHR methodology that might help some of these questions about where's the data, who collects it, can we do it?
Yeah.
You have answers.
Thank you so much. Well, collectively, we hope to find the answers. Usually the international framework seems very far away from us, at least for those of us who are not working with it very much, and it can sound it. And then the topic of statistics, no, it's something that it's not quite appealing, let's say. What I'm attempting very much, and I hope to achieve it, is like just to try to transmit the message that there is very logical path from I have international obligations, I have national obligations, I have the treaties, I have my constitution, I have my federal legislation, I have my national legislation, I have the regulations to my laws, okay? So normative framework is there. Then they have examined it internationally, and then public human rights institutions, as we saw in the morning, and then in many cases also Council of Europe, right? All these bodies, they emit recommendations. So all this is input to how I should define my policy. All this, ideally, I should take it into consideration. This policy, however, should be defined, and I'm still at policy level because from there we start, should be defined through participatory processes with all interested groups and with all affected groups, okay, by the policy. And then all this body of normative framework, public policy should be subject to measurement and monitoring. OHCHR indicators framework, you can find it online with this guideline, Human Rights Indicators Guide for Measurement and Implementation. It was published in 2008. Then through this guide, it was operationalized a little bit better. This is a longer publication. Is a framework that translates international standards into measurable unities, into human rights indicators. So basically speaking, what you are going to find in our methodology are proposals for indicators with human rights perspective, which are not entirely different from what different countries have their national statistical general laws or national statistical institutes obligations that are defined at country level. The human rights perspective, in fact, how do we insert it? We insert it in three very specific ways. One of them is translating international, let me move a little bit forward, translating international obligations, okay, of each right into so-called attributes of the right. This means what are the main themes? When I speak about the right to health, what are the main areas that the right to health incorporates? Okay, it's physical, it's mental health, but it's also access to medicines, it's also access to health facilities, it's also general comment number 14 that we saw before that has to do with adaptability of services. So all the international framework is being, now you will see you have a copy of the human rights indicators on the right to health there, shared with you. You can see which are the essential elements of the right to health. Okay? Then our framework is specifying the so-called structural indicators, which is basically speaking the checklist. Do I have the legislation? Do I have the public policy? Do I have the relevant bodies, public human rights institutions that can monitor the implementation of the right in my state? Then we have process indicators. Here is everything that the state, or for this context here, the EU is making in order to advance with the implementation of the right. And then what is the result of everything that we are doing? Sounds very straightforward, right? So we have, in the case of the right to health, obligation to measure aspects related to sexual and reproductive rights with information disaggregated by race and by non-relevant population groups. Child mortality and healthcare, natural and occupational environment, prevention, treatment, and control of diseases, and accessibility to facilities and essential medicines. Okay? It's too much to cover in 7 minutes, and this is only the right to health, besides it's connected to food and so on and so forth, not many other rights. The thing is that once you see this matrix of illustrative indicators, we start the process of contextualizing it for the specific necessities in different countries. From illustrative indicators that we have in the methodology, they are shared with you. There are around 30 indicators. The moment when you adapt them to the specific context in a different country, or why not also at EU level, those number of indicators usually go up to be around 60. Health indicators in any countries are much more than 60. Countries have the information. The information that is missing refers to what aspects? First, public participation, okay? Transparency and accountability. These are the cross-cutting human rights issues. Let me move a little bit forward to see them here. Non-discrimination and equality, and accountability. These are the added elements to the national statistics that usually, at least here, most European countries have, that require adapting either surveys or censuses, and I will go one slide back and here I will finish, is administrative data and socioeconomic and administrative statistics. We touched upon this topic in the morning. So not all data for public policy evaluation or for monitoring the level of implementation of international obligations of states has to come from surveys. In fact, surveys are one of the most limited instruments that we have, because they're extremely expensive and because we cannot have the adequate representativity. Whoever is statistician here knows. If I need to disaggregate information by that many characteristics, I need to be increasing very much the sample. That's why the biggest investment that we have to make is in administrative registries and statistics, and this is working exactly as you were mentioning with the health ministries, with anti-racism entities, with the ministries of women,
or secretaries of women, whatever it's called, the structure in different countries, use as an input. This comes from international bodies, events-based data, not only surveys, not only national statistics, perceptions, opinions, and surveys as another source of information, and information provided by experts. There are, I think, 7 more slides included. Play with this. You have in the PowerPoint also the link to your indicators page, which can give you a lot of additional information. Thank you.
Thank you very much.
I'm going to talk to myself a lot. We done?
No, we have about 5 minutes if people have questions. We did promise that Mila is an absolute resource, a well of information. I'm sure you've got a lot to digest. And as promised, she's got a sort of 50-page PowerPoint, which will be yours afterwards. She showed you links to interactive pages where you can go elsewhere. You've just had a crash course on international rights in treaties and normative processes. So don't worry, we're not going to give you a test, but there is an opportunity if you'd like to raise a question or ask for clarification. Yes, I already see a hand up.
Thank you so much. My name is Irfan. That's enough for now. So I've just come straight away to the question. First of all, thank you for giving us such a brief and concrete presentation about such a crucial topic. And my question to you is that, you very well, beautifully mentioned that in the International Declaration of Human Rights, about all the domains, there is health, which is really, really mentioned explicitly in all of those declarations. So, and we see that you also mentioned that there are key indicators. And my question to you is that it is there, and do we see a future of Europe where not only like the policy, it's about the policy, for example, where we in Europe or citizens of Europe could see from policy level or legislation level health in all policies approach. I know that it's very new and people really think that, oh my God, it's too new, we cannot do it. But I believe that Europe has the capacity to do this. And do you think that in coming years, probably next 10 years, do you think that is the new deal for Europe?
In all policies approach. Well, I will probably give slightly evasive answers since I do not work in the topic of European policy making, and this is official space. I cannot give opinion about this. What I can tell you, and I think it's a very positive message, is that if you start from the international normative framework that you have set all the grounds for doing so, and you're advancing not only here, but in other parts of the world, because rights are interdependent. So health should be mainstreamed, anti-racism should be mainstreamed. This was in one way or another the idea behind the, what was it before the Sustainable Development Goals, MDGs. This is the idea. We have been transmitting this message, honestly speaking, since 1948, when the international normative framework started being developed. And before this, it's also has been this message transmitted from very different cultures, that everything is interdependent. So my answer, stepping on the normative framework, is yes. And I will use the opportunity just to move one step forward. Is it possible to do all these measurements here in Europe? Many Latin American countries did it. Does it take time? It takes enormous amount of time. Operationalizing and contextualizing just the matrix on the rights of, on the indicators on the right to health took us in Mexico over 16 months. But it was done in collaboration with civil society, public human rights institutions, and then Ministry of Health, and so on and so forth. Then it was extended across the continent. The same was done on justice, the same was done on prosecution of justice. And when there is really the understanding that the international normative framework influences, in the positive sense of the word, the definition of policy, what is human rights-based approach to policy? And this is what the anti-racism unit has also produced as a document. Okay, we have the anti-racism plan, and how do we move forward with it? It's like, if this is really taken seriously, you can have really good connection between health, mainstream, even though it's a right, non-discrimination, and measurement. Thank you.
Excellent. Thank you very much, Mila. Now, we're going to ask all of you a question because we heard at the beginning of the day that this is the first of what we hope is a series of conversations, and that's an ongoing process. So what we'd like to ask you, and we're going to give you a Slido polls, we'd like to get a sense from you of all the things that you've heard us speak about so far today. Which one would you like us to see put forward for the next future event, an in-depth conversation, more exploration? Because this is not, we don't finish at 4:30 and close the conversation. This is the beginning of a deeper framework. So what topics would you like to explore in more detail? I mean, Mila, you set out a huge range of different issues, including the political will, the commitment, the data, the statistics, the monitoring frameworks. There's lots of different things we talked about, but let's hear, what would you like us to pick up in more detail in a follow-up conversation or conversations in this format or others? So thank you. We're starting to get some messages. If you want to know, how do you make practical advice for health professionals, presumably? How do the norms get translated into laws? How do you implement what you just set out? And then solution-based policy, which is looking at how you can use policy to address the gaps that you found. So this is great. Thank you. Keep giving us your ideas about how you'd like to take these ideas further to make them more practical, because that's very helpful. How to repeat Mexico example for the EU. That's a good suggestion. So thank you. We'll keep doing that. And while people are putting that in, can we say a warm thank you to Mila for her whirlwind tour of what's probably a master's course in international law. You did it in 20 minutes. So.
Lawyer.
Well, neither are we, and that's why we understood it. Thank you.
Here, if you just allow me one more second, they just sent me the reminder 3 times, and I got carried on with the other topic. Really, this is the first of a series of seminars that we are co-organizing, and we really would like to start spinning off the topic of health, addressing less addressed but very well known problematics, including those that you are mentioning, but also to guide you a little bit to think about specific topics and groups of people. For example, we were thinking about disabilities. We were thinking about mental health of people from different racial and ethnic origin, about the intersection between education and health for people with ABC conditions. Okay, so if you would like to expand a little bit more in your wishful thinking, that the letter that we are making with our wishes for the future, we would really love to see your input, because we are between health and education in specific groups, but still the idea of what to do is going to be based on what you think.
Thank you.
And this, because otherwise
and so you're inviting us to think about particular areas where the right to health is not adequately delivered, particular communities or populations that they experience discrimination, and how we could, focus in on that and explore it more. So thank you for that. Again, I'll leave that open for a moment to help people think on it, and even if you think of something after we finish today, you're welcome to keep sending it in so that we're aware of the different ideas you like us to deal with. It takes time to develop an event, so it's not like tomorrow we'll do an event. So feel free to let us know this issue needs more attention, needs more reflection. And I spoke to someone over lunch, and she raised an issue that we haven't touched on at all, which is around neurodiversity. And that's in its context of different cultures and different communities, different ways of communicating, different ways of approaching mental health. So that's another additional input that you suggested to me that I wanted to make sure that we referred to. So thank you for that, and we'll keep building up that picture. Thank you again, Mila, and your great PowerPoint is available for people to take away. There's materials on the table, including that overview of the different rights of health and how that can be monitored. So what we're going to now do, and I'm going to bring up a panel of people who will help us explore it, is we are going to go from the sort of theoretical outline of what's written in the treaties, what are the comments given by international bodies on how you should apply the right to health. This panel is going to say, what is the role of civil society in advocating for and trying to turn the right to health into a practical reality for all communities?